Hello, this is Steve Vargo with iDoc, and the question of the week this week was, how do I see more patients in a day? And this particular office was a busy practice, and they were it was a one doctor practice, and they were booked out for several weeks, and they wanted to be able to see more patients in a day. And this always brings up the discussion of, when do I add an associate, and that's always part of the discussion. Usually I like to look at the current workflow to see if there's something that we could change in the environment. Could we operate more efficiently for the doctor or doctors that are in there now to be able to see more patients? And we always wrap that discussion in context of being able to do that in a way that does not compromise clinical care or the patient experience. And so a lot of times this brings the discussion to efficiency and how do we operate more efficiently so we can see more patients without losing anything of value. And the areas we typically discuss, and if we get more in depth with a particular office, we'll go more into specifics of that office. But at a sort of a macro level, usually what we're talking about here, or the areas I'm focusing on, are around elimination, for one. There's three different areas really I'll look at, and one being elimination. Could we just stop doing something that nobody would miss, that we're not losing anything of value? And productivity experts talk a lot about this in getting more done, looking at all the things on your to-do list. Are there things that we could just knock off and stop doing, and we wouldn't actually lose anything of value? And that gives us more time to work on things of a higher priority. Another thing is delegation, and a lot of doctors in particular will take on a lot of work on themselves, and I have to remind them sometimes that they have a team, they have employees. So do we need more delegation in the office, or maybe we even need more staff? Maybe we need to hire more people. And third, I typically will look at automation. Are there things that we could automate? Are there things that we could outsource that would take some work off the current staff and make their job easier, to give them more time to focus on the things that are going to add the most to the ability to be able to see more people, again, without compromising clinical care or the patient experience. And I'll add that if your goal is not necessarily to see more patients in a day, but you're still focusing on efficiency, I think what you'll find is there's benefit to that as well, because it actually creates more time for each individual patient, more quality time to spend with them. And I think that'll create a better experience, better patient experience, and be of benefit to everybody, really, to you, the staff, and your patient as well.